Morning. Jeremy is a child who has a serious heart problem. He needs open heart surgery because his parents are Jehovah's Witnesses and the physician is not allowed to use blood transfusions. So it seems like that the physician has a problem because the physician wants to save the child's life, and on the other hand, he has to respect the wishes of the patient. Many people have criticized the tough stance of Jehovah's Witnesses because many people think that bloodless surgeries are or have very negative implications or consequences. However, this is not true because many studies and many physicians, for example, Dr. Francesco Mercuriali, who works in the University of Milan, they consider that bloodless alternatives have more benefits than risks.
Just to give you a bit of background, bloodless surgery is an approach to healthcare which began in the 1960s, and it mainly has to do with avoidance for use of transfused blood. Eventually, it created a new opinion towards treatments, and also new technologies have been implemented. Programs were mainly developed for Jehovah's Witnesses who declined to receive blood for religious reasons. However, patients and physicians as well have advocated this approach because of, in order to avoid the effects of allogeneic blood transfusions. Basically, our claim will be that we support bloodless surgery because it reduces the risks of standard blood transfusion, it benefits the patients, and it considers the patient's right, and also the methods applied are quite effective.
First, we have to keep in mind that allogeneic blood transfusions have serious risks, and I mean serious risks. For example, according to Azriel Shander, who is a physician that works in the Inglewood Hospital in New York, he said that the risks can be classified into two types. First, non-infectious causes, which include viruses, bacteria, and other parasitic organisms, such as AIDS and hepatitis, which are very bad diseases. Second, we have non-infectious risks. And basically, this is related to mistransfusion or human error. Well, it's terrible, but this is the largest concern because there are always mistakes in relation to the blood typing and patient identification. As an example, the serious hazard of transfusion honor report, and well, this report shows the serious impact of the blood transfusions in relation to this problem about human error. For example, in 2002 in the United Kingdom, 315 adverse events were reported, and 67% were due to mistransfusion. I mean, wrong blood to the wrong patient. And many times this problem cannot be avoided.
Right. According to Azriel Shander as well, on his article, Estimated Cost of Blood, it's important to state that most people don't realize that the cost of blood is quite high. Rebecca Frey, PhD, in his article, Blood and Surgery, states that a New Jersey hospital considered that a blood transfusion could cost around $500 per patient. She also reported that in an article from the American Journal of Surgery, I mean, the transfusion is for free, that's for sure, but preparing, storing, transporting, and unpackaging that blood can cost up to $1,043 per patient. Azriel Shander also says that blood preservation, I mean, that means to keep blood safe from viruses, from bacteria, implementing checks to assure the safety of this blood, and also considering adverse effects in the short and long term also helps a lot to the healthcare expenditure. Patient mortality, organ failure, and increased hospital stays are part of the increases that this include. Basically, the more steps are needed to deliver the blood, the higher the cost. Also, an aspect which is often omitted is the legal side of this issue. Litigation and damages awarded are very, very expensive. Missing documentation, insufficient tests, wrong transfusions to the wrong patient can have cost up to $500 million. And this is an aspect which is not often told very much. And also, hospital stays many benefits from the opinion of the patients. They are quite satisfied, recovery is faster, and fewer complications eventually arise. You have to also to consider that a stay in a hospital might take, for example, $3,500 per day. And if that stay is reduced, obviously the patient gets benefit from that important safety. Another aspect to consider is that bloodless alternatives respect the patient as a whole, respect the autonomy of the patient, based on two principles. First of all, informed consent and self-determination. According to Tomonori Ariga and Shiro Kiyosaki, in a study considering the ethical and medical aspects of blood surgery, a Japanese woman once had a malign tumor, and she signed papers in order to demonstrate that she would be against any kind of blood surgery. She would release doctors or anyone at the hospital from liability if anything went wrong. However, 3 years after she died, they realized that the doctor made a blood transfusion. The Japanese court failed in favor to her because there was not, her right to decide was not respected. And regarding to self-determination, it's very crucial to say that even minors can decide on this point. I mean, even someone who is 12 years old, who can give an opinion by him or by herself, can take a stand on this and say, no, I don't want any blood transfusion. And hospitals and judges, some hospitals and judges alike support this position. What happens when children are not able to decide themselves? Say they are just months old or they're 5 years old, it's up to the parents. But there's been a fallacy on this that says that when parents do not want blood for their children, they immediately want their death, which is not true, because there are alternatives. They're just not taking one, but going for alternatives. And this also is very important because abuse of parental rights is often stated, which obviously is not the case.
So, in order to reduce these consequences, blood conservation should not be an option. It has to be a must. Actually, there are many alternatives. For example, there are some examples here. We would like to talk about three of them. For example, according to Dr. Chandler, the alternatives can be classified into two types: preoperative and intraoperative techniques. For example, there are some stimulants like EPO or erythropoietin, which basically has to be taken 5 days before a surgery. This stimulant increases the patient's red cell mass. We have to remember that before a surgery, a patient needs a high level of red cells. So this stimulant is very good. And actually, there is a new product which is called the Mircera. This is like a third generation version of erythropoietin. Basically, it's like a super EPO. But this is This is not used in Costa Rica actually because it's very new. Second, well, we have hemodilution, but basically this is the graph. Hemodilution, well, we have to use a special fluid. In this case, many hospitals use Star 200 in order to increase the volume of blood of the patient, so the real loss of the patient is going to be less. And finally, we have the cell salvage, and this is how it works. First, the blood is removed from the patient and put into a bag with anticoagulant. Next, the blood enters into a special machine, and with a saline fluid, the blood is washed. And finally, well, the waste is transferred to a bag, and only the red cells return into the patient. According to Dr. Donald Spang, who works in the University Hospital in Zurich, he said that all these techniques are cost effective, they are cheap, actually very beneficial for the patient, and they significantly reduces the need of ABT or allogenic blood transfusions. Now, well, what happens if a patient suffers from a massive blood loss? Are these techniques applicable for trauma or emergency cases? Well, they are. We have to keep in mind that if a patient suffers blood loss, the oxygen delivery might be reduced, so we have to act quickly. In addition, the tolerance to anemia differs from one patient to another, but these alternatives can be applied. Well, some of the implications, well, some physicians or some experts think that the cell salvage can produce some inflammatory problems on the patient. However, this is completely safe in the sense that it reduces or the need of blood transfusion, so there are no risks of infections.
And real quick, many people might say, well, there are risks. Obviously there are risks. Any surgery involves risks, but evidence is what really supports here. For example, all the evidence that is that blood transfusion can do you harm, yet people believe in it badly. Ivor Carville, senior fellow of hematology at Cardiff University. Also, there's an avalanche of data that supports bloodless medicine. Dr. Edwin Dage, chairman of the Department of Surgery at New Jersey Medical School. The many opinions of this really support the process of bloodless surgery.
So, we have analyzed all the serious risks and the cost of blood transfusions. We have analyzed too the benefits of bloodless alternatives that have to be taken into account before a surgery. And also, actually, it's important to remember this, what Dr. Francesco Mercuriali says. He said that the safest transfusion is the transfusion never given.
Basically, what we want is that if we need one day to have surgery, is to get informed, to look for information, and also to consider this possibility not based on beliefs, but based on the evidence that the new technology implemented and new research has given us in order to get better health and better condition. Thank you very much.